In this video, we're going to talk about what an event sheet is and the importance of event sheets. However, before we do that, we're going to discuss which form needs to be filled out for which kind of patient. So a patient walks up to a GEMS medical crew. We want to go ahead and identify whether that patient can be treated with simple first aid. Simple first aid meaning that they can be treated with very simple maneuver or treatment such as an ice pack or a Band-Aid or bandage. Basically some kind of simple treatment. If they can be treated with simple first aid, we only complete the patient log. However, if it's a patient that requires more than simple first aid, such as an in-depth patient assessment, an ALS patient, or any kind of other patient, we want to go ahead and establish whether the patient wants transport to the ambulance, wants transport to the ER by ambulance. If so, we need to complete a patient log and a patient care report. If the patient does not want transport to a hospital by ambulance, then we need to complete a patient log, patient care report, and an AMA or release on scene form. Here's what an event sheet looks like. You see, it is a two-sided form. The front has information about the event, the back has the patient log. So the event sheet will be made for each event. It will contain the information you need to know about the event, including the employees working the shift, employee certification levels, personnel numbers, the event name, the event date and time, the event location, the contact name and phone number for the event, emergency contact information, and any specific notes about the event. It is very important to make sure that you have an event sheet prior to starting your event. If you do not have an event sheet generated by a manager, you must call the on-duty supervisor immediately to get information about your event. In other words, if you find yourself going into the bag and grabbing a blank event sheet, you must call the on-duty supervisor to get the required information as it pertains to your event. So starting with the top of the event sheet, we have the crew information. This outlines everybody who was assigned to the event. It's going to include their name, their personnel number, and their certification level. Now, as an employee, you will have to fill out the in and out time. The in time is the time that you are clocking in for work, and the out time is the time you are clocking out for work. Now, these should be consistent or similar to your time clock punches from ePro Scheduler. This actually serves as a backup to the time clock system in case there is a problem with ePro or with the time clock. Now, depending on the event, you may need to write your information or your name in the crew information section. Not all event sheets will have the crew information filled out, so please make sure your name is on the event sheet for the day. Below the crew information is the event information. And the event information is going to contain the name of the event, is going to contain the date of the event, is going to contain the start time. So this is the time that you must be on scene ready to provide coverage to the event. We're also going to have the event end time. This is the contracted time the event is scheduled to end. We are going to have the contact name for the event. So this is the person you're supposed to make contact with when you get to the event. We're going to have their phone number and any emergency contact information. Now, the emergency contact information field is more so specifically related to ambulance transport and who to call when an ambulance transport is necessary. Depending on the event, you may have to go through security dispatch, law enforcement dispatch, or make contact with the ambulance company directly. Below the event information section is going to be the notes section. And this is where we are going to write specific information as it relates to the event. For example, notes about the event, directions, other contact information. However, you may also use this area to write down important information, such as issues noted during shift, broken equipment, reasons why you were held late, or any other important information you would like management to know. Now, when you go to fill out your event sheet at the beginning of every shift, you must complete a daily checkout form. Now, this is only required if you are working first responder shifts and not on an ambulance. Ambulance shifts, everything is going to be tracked through ePro Scheduler. However, if you are working a first responder shift, please make sure to fill out the equipment checkout. In the equipment checkout, we want to know your BLS bag number, your clipboard number. We want you to open up the bag and get an oxygen level, so check the PSI of your oxygen tank. There's a video labeled here in case you need assistance with seeing how to check the PSI in the tank. We also want to know the AED number. And we also want to know the date the AED pads expire. All AED pads expire. You see on your screen that we have some photos showing you where the AED pad expiration dates might be located. And lastly, we also want to know about any AED errors. So you should perform a visual inspection of your AED to ensure that no errors are present. Every AED comes with a way to quickly check its operational status. This might be in the form of a light or message displayed on the device. You see with the LifePak 500 that the screen is on the handle of the device and says OK. If there is a wrench icon, then that means service is needed. For the Philips FR2 devices, in the upper right-hand corner is an hourglass sign. If you see an X, that means the AED needs service. And for the Philips HeartStart AEDs, there is a green light that will be flashing in the upper right-hand corner of the device. If you see a red flashing light or no flashing light at all, that means the device requires service. In addition, if the device requires service, you will hear an audible chirp. Do not ignore this audible chirp. If you hear an audible chirp and see that an AED requires service, please notify the on-duty supervisor. Below the equipment checkout list is a restock list. This is where you can write all supplies used during a shift. If supplies are restocked during a shift or at end of shift, please make sure to cross out those restocked items. A manager or logistics will restock all items that were not restocked by crew members. Here's an example of what I'm referencing. You see that the items that were crossed out means that they were restocked either from an ambulance or from somewhere else, or at end of shift. The items that were not crossed out need to be restocked by a manager or logistics. At the bottom of your event sheet, you will notice that there are 4 boxes for times: leaving office, at event, leaving event, and back at office. These boxes contain the most important part of the event sheet because they are used to bill the client. Meaning, if these boxes are not filled out appropriately, we cannot properly bill our clients. So the leaving office is the time that you leave the office with an ambulance. If you are driving directly to an event in your personal vehicle, we are going to leave this field blank. The at event is filled out by everyone, and this is the time that you get on scene at the event. This may also represent the time the event starts. Leaving event is the time that the event is over and you are leaving the property of the event. And back at office is the time that the ambulance crew arrives back at the office. If you drove to the event, make sure to leave this field blank unless you are being paid for travel time. And then below that, we have a release signature. The release signature is to be signed by a representative of the event, if available, when leaving the event. Now, this concludes the front of the event sheet. We are moving to the back of the event sheet. The back of the event sheet is used to document all patient contacts, including simple first aid requests and all advanced procedures. Regardless of how minor the complaint is, the back must be documented on the back of the event sheet, or correction. The patient must be documented on the event sheet regardless of how minor or major the complaint is. If the patient presents to first aid with a simple complaint, then the event log or patient log is the only thing that needs to be filled out. If the patient presents with a significant medical complaint, we need to go ahead and complete a patient care report and AMA if applicable. At the very top of the event sheet, we want to know the name of the event. And then when it comes to documenting patient contacts, we want to make sure that we fill out the date and time of when we see that patient. It's important to make sure that we fill out the time of the event, and the reason being is, or correction, not time of the event, but the time the patient presents to first aid. The reason why this is important is because we data trend when we see patients. So if we get hit with a lot of patients in a short amount of time, we can show the client that this is a problem and try to get additional coverage during those times for future events. The next box is the last name of the patient. So this is their legal last name. The third box is going to be the patient's legal first name. The fourth box is a note field. This is an optional field on the patient log. In fact, it is the only optional field on the patient log. Now, some events, like running events or triathlons, may require us to document a runner number. If the patient has a number issued by the event, we must make sure to document that. It can also be used to document other information asked by the client or to document specific pertinent patient information. The fifth box is the patient's date of birth, and the sixth box is the patient's age. Please make sure for all requests we are documenting the patient's date of birth and age. The seventh box is the patient's chief complaint. Now, the chief complaint is the reason why the person is requesting EMS assistance. The complaint field needs to be specific to the body parts and not be diagnosis unless stated by the patient. For example, right arm pain, head pain, chest pain, left forearm laceration, a blister on the right foot, or I'm having troubles with my asthma. The eighth box is a treatment field. This is where we can document what we did for the patient. For example, if a simple first aid was done, we can go ahead and say we gave a Band-Aid or an ice pack. If the patient requests their vital signs to be checked, we want to make sure that we write down in the complaint that we check their vital signs, but then in the treatment area, we actually want to write down those vital signs. Just don't write check vitals. Please make sure to write down that vital or the vital signs that were taken in the treatment field. If the vital signs are abnormal, please make sure that we treat the patient accordingly and fill out the appropriate paperwork, including an AMA and a PCR. And then for transports or AMA, we can just write a brief description of what was done, including where the patient was transported, or AMA, or we can just simply write C documentation. You'll notice that we have some other checkboxes inside the treatment field, including first aid, PCR, and AMA. This is basically for us to keep track of, to make sure that all patient care reports and AMAs are documented on the back of the event sheet. So just make sure to check one of those boxes. I need to reiterate that all fields on the back of the event log or patient log must be filled out to the best of your ability and circumstances. And yes, this includes the patient or the time the patient presents to the GEMS crew and the patient age. I just want to repeat that you must document the age even though you are getting the date of birth. Now, one thing I want to point out is that occasionally patients will seek medical attention to have their vital signs checked. If the patient is asymptomatic and simply requesting to have their vital signs checked, we go ahead and write down that we check their vital signs and then write down the specific vital signs in the treatment area. No further documentation is needed unless the patient has abnormal vital signs or a significant complaint. Then we need to complete a PCR and AMA if required. If you have any questions about the event sheet or patient log, please make sure to contact the on-duty supervisor.